business case presentation is titled the Oncology Nurse Navigator Project. Mercy Medical Center is a small Catholic Health Initiative hospital located in Williston, North Dakota. It is located in the epicenter of the Bakken Shale oil boom. The population in Williston has tripled in size during the past 7 years, and this has led to growing competition for patients from other health systems. Williston's population tripling in size has not produced commensurate new oncology patient volume for Mercy. The total number of new medical and radiation oncology patients actually declined between 2011 and 2013. According to the North Dakota Tumor Registry, Mercy's Cancer Center is capturing only about 1/3 of its potential patient population. 3 factors contribute to Mercy's inability to capture new cancer patients. Mercy's general surgeons do not perform cancer surgeries. Mercy lacks many referring subspecialty physicians. Patients believe that they must travel to larger medical centers to get the right treatment. Hiring an oncology nurse navigator can help stem the loss of new oncology patients at Mercy. An oncology nurse navigator provides patient education, care coordination, and support for cancer patients and their families. The oncology nurse navigator can also identify new cancer patients at the time of diagnosis, arrange for an oncology consult within Mercy's Cancer Center, monitor patients' progress through outside staging and surgery, help retain post-op patients within the Mercy system, and create a more positive patient experience. The cost to initiate the Oncology Nurse Navigator program at Mercy is estimated to be $92,200. Mercy will recoup the startup costs in the first year by treating an additional 1.34 new oncology patients with both chemo and radiation therapy. The 5-year return on investment for the program, calculated using a 10% annual increase in new patient volume, is 3.58. The Oncology Nurse Navigator project is an excellent fit with CHI's mission and vision. It creates a patient-centric program with the nurse navigator serving as a patient advocate. The measure for the program's success will be, number 1, improved patient satisfaction survey scores for the oncology department pre- and post-implementation by greater than 10%, and number 2, increasing new oncology patient volume by greater than 10% annually. The project failure criteria will include the inability to retain a nurse navigator for the cancer center, the failure to meet the 10% improvement in patient satisfaction score, and failure to grow new oncology patient volume by 10% annually. The environmental failure criteria include failure of the hospital to fund the nurse navigator program, the inability to obtain support from oncologists for the program, objection to the program by community physicians, a merger or buyout of the Mercy Medical Center by another healthcare system and the program is aborted, failure of patients to accept the intermediary role played by the oncology nurse navigator. There are 5 phases to the project timeline. Phase 1 begins on December 1st, 2013, and involves obtaining administrative and complete physician approval for the project. Phase 2 involves internally recruiting and hiring the best qualified oncology nurse for this position. Phase 3 will involve scheduled training for the new nurse navigator. gather of teaching and documentation materials for the project, team building with the oncology department staff, and liaison with North Dakota Tumor Registry as well as community physicians. During phase 4, the nurse navigator will begin navigating new cancer patients. She will also revisit community physicians every 3 months regarding any issues which have arisen. She'll also perform patient satisfaction surveys and monitor new oncology patient volume. And phase 5 involves reporting of patient satisfaction survey results and tallied numbers of new oncology patients treated at Mercy's Cancer Center pre- and 6-month post-implementation of the Oncology Nurse Navigation Program. The project alternatives involves, number 1, hiring a general surgeon capable of performing cancer surgeries. The pros of this approach are that it ensures that most cancer surgeries are done locally, will enhance the hospital's reputation, add cases to Mercy's underutilized new $50 million outpatient surgical center. The cons to this involve the cost, which is at least $500,000 to initiate this project, the difficulty to attract new surgeons to rural North Dakota, and it is difficult to garner support from the 3 existing surgeons. The second project alternative involves hiring a lay navigator instead of an oncology nurse navigator. The pros involve are the good communication skills of the layperson, good connections within the community. The person will be able to assist patients with non-medical needs. It'll cost less in salary and benefits than hiring a nurse navigator, and it'll obviate the need to recruit replacement oncology nurse for the cancer center. The cons are the lack of medical background may impede patient education regarding medical aspects of cancer care, failure to readily address medical issues arising from the treatments, and difficulty in steering patients through the complex maze of treatment process. In summary then, Mercy Medical Center needs to increase its revenue. The hospital needs to increase new cancer patient volume. The Oncology Nurse Navigator program will identify new cancer patients at the time of diagnosis and decrease out-migration from the community. And the Nurse Navigator will provide education, support, and improve communication between patients and their physicians. The $92,000 startup cost of the Navigator program is reasonable. The program pays for itself and generates new income immediately, and it is the best alternative for enhancing cancer care in the Williston area and offers Mercy Medical Center future financial growth and stability. Thank you very much for your time and attention for this presentation. Take care.